Hello and welcome to Midlife Moments with Dr. G. I'm Dr. Georgina Hale, specialist medical doctor and PhD in midlife women's hormones. And today I'm talking about a really annoying complaint that many midlife women have, and that is an increase in midriff weight. So increased weight around the middle. Now, this isn't a problem of age. This isn't a problem of calorie intake. This isn't usually a problem of exercise, because I often see women who've done all of that. They've done the calorie restriction, they've done the exercise, and they've done everything they can to reduce that, but it still comes on so easily. So what is this? So in my practice, it's not very well addressed in the literature, and in my practice and with my functional medicine approach, I'm seeing the underlying causes or contributors so that I can actually help women reduce their midriff weight. Now, it is often associated with a feeling of bloating and often associated with other kind of gut health issues like constipation or loose bowels. Also, abdominal distension and abdominal pain. About 35% of midlife women complain of bloating and about 20% of constipation and about another 15% of diarrhea. So there's a lot of changes in gut health at midlife. So some of the contributing factors that I have discovered is it's probably a lot to do with an uptick in the production of estrogen, and I've talked about that before. Difficult to capture on blood tests, but we know that there's an uptick in estrogen production, especially during the midlife and then into the early perimenopause. Now, this higher estrogen appears to have an effect on slowing bile production and bile flow. So at midlife, we're more susceptible to bile sludge and bile stones and getting cholecystitis or having to have our gallbladder removed. So this probably has something to do with being able to, or a reduced ability to detoxify. So maybe this has a lot to do with gaining more weight around the middle, getting distended and having more bloating. So I've found digestive bitters have been very helpful for some women. So it's really worth trying for midriff weight and any of those sort of distension feelings. Bloating, etc. So digestive bitters. I talk a lot about that in section 3 of my book. Now, the other thing to consider when you've got a lot of weight around the middle is, are you inflamed? Are you stressed? So they tend to go together. So have you got a sleep disturbance that you need to get fixed or you need sorted? Because reduction in your sleep increases your stress, increases your cortisol, and high cortisol is very commonly and very well known to cause weight, especially around the middle. And it's very important to address sleep because it has so many other effects on our health. So poor sleep, poor health, adverse health outcomes. And so the other thing that I always address in women's health is anti-inflammatory diet and an anti-inflammatory lifestyle, so stress reduction. So with the marrying of the midriff weight and gut health and the anti-inflammatory diet, this is usually around food elimination. I just don't think we can eat the same way we used to as young women. And I think one of the key things that you can do as you approach midlife is to reduce the inflammatory foods, which tend to be the gluten-containing grains and also the high lectin foods. High lectin foods are, you can look those up, but they're the pulses. But you can eat them, but you have to sort of process them in a different way. So gluten-containing grains, and even grains. If someone's very overweight, I say no grains for you. We'll just concentrate on vegetables and meats and chicken, etc. And I find this really helps to reduce whole body inflammation. It helps reduce the distension, the feelings of bloating and the midriff weight, along with some digestive bitters. So I hope that was helpful, and don't forget I've got my new book out, and I cover so much of that in section 3 of my book, and I hope that you will perhaps join in the discussion. Just let me know after this video if there's any other subjects you really want to hear about, and how I usually approach them in my practice, in my women's health practice. So until next time, all the best. See ya.